So today we're going to be talking about ozone cupping. The great thing about ozone cupping is it can be utilized in specific areas outside of the limbs. We discussed limb bagging for upper extremities, lower extremities, but you are going to get some areas where you cannot reach with the limb bags, thus the cup. And what is this good for? This is actually good for wounds, so open wounds. Let's say something on the chest, it could be a scratch, it could be something that has been persistent, a chronic wound that isn't getting better. I discussed in the limb bagging video about a patient that we actually worked with that had gangrene, persistent gangrene for like 8 years, and no conservative treatment or natural treatment that we were utilizing before had helped. And so we started utilizing ozone. Now let's say that there was a condition like that, say on the chest or the back, or even the glutes, upper thigh, that could not be reached. That's where the cup is actually going to come into play. So ozone therapy specifically, when utilizing whether it's a cup or the bag, is very beneficial. It has anti-pathogenic effects, so it's going to actually help to get rid of any bacteria or anything that's sitting on there. It's, in a sense, it actually creates almost a debridement a little bit, not like something's being cleaned, but it actually cleanses the area. It increases collagen production, growth factors. It's going to increase microcirculation, all the things that we need to actually help to restore that natural tissue. I want to make a disclaimer first and foremost that this is not an FDA approved therapy. You always want to speak with your physician first before starting any new therapies. And these treatments and these modalities and therapies are not here to treat, cure, or prevent any sort of disease. The information that we're providing today is for educational purposes only. How do we do this and what do we need? We actually need a cup. So we've actually gone through a few times in our videos and discussed the destruct units. You can see the destruct like this that usually is attached if there's going to be, excess ozone coming out of, say, the limb bag, because we want a closed loop system. The cups actually already have that built in. You can actually see on the top that we have the carbon in here. So as the ozone goes in through this tubing, it's going to fill this area, but the excess is going to come up and out directly through here. So when you are using this, make sure the cup stays suctioned directly or tight to the skin. We don't want it leaking out on the side. So what do we have? We have our tubing. So the tubing specifically is going to then come from here directly into the ozone output. So we have our ozone output right here. Just like with limb bagging, because it's hitting kind of more of a surface area, we're probably going to do higher doses. So we would go between 57 and 71 gamma, which our setting on our regulator is going to be around 10 or 11. For specific protocols and information there, frequency, make sure that you check out the link below because we have those in that link. But what do we do next? We have everything set up. Nothing is turned on at this point. What you would want to do is you want to place the cup specifically on the area. So let's say that it's chest, the belly, wherever you want to do it. I mean, even the shoulder, it can be held right there. Once it's applied to that place, what you want to make sure is that your oxygen is turned on. We're going to set the regulator to 10. So we're going to click it to 10. We know that we're at 10 here. Now we have oxygen going through. At that point, you could then place the cup on that area. Now we want to turn the generator on. Once the generator is on, it is actually going to flow that ozone through the tubing directly into the cup. The cup is actually placed on the table now, so any excess ozone has actually come up through this filter and destruct and turn into pure oxygen, so we're not going to be affected. Once you're done with the treatment, again, check the protocols for the frequency and the time. You're going to want to turn off your generator first. What you want to do then is come over, turn the regulator to 0, turn that off, remove this, and the treatment is done.